Hi everyone. Today is February 28th, 2017. My name is Megan Spradlin, and this video is essentially documenting the steps I have taken and the steps I will continue to take throughout the deep brain stimulation surgical processes and the subsequent follow-up appointments that accompany it. So I'm making this video because I know that there are a lot of people with essential tremors who are reluctant to consider any of the surgical options even when medication has failed them, largely because it's scary. For the longest time I swore I would never ever have this procedure. The notion of having something foreign in my head to assist with control over my own body when I already struggle with control over my own body due to essential tremors, being a movement disorder, it just resulted in a circular thought pattern that was dumb. Well, I shouldn't say dumb, but less than logical. And as someone who struggles with major depression and anxiety, it's a process. Everything is a process. Life is a process. I mean, I guess you could say that about everything. But so I guess I'd start off with the timeline of events. The tremors first made an appearance when I was around 8 or 9 years old. I first noticed them because when we would pass papers forward, the papers would shake a little, and sometimes the kids in front of me would take the papers from me, and they could tell that I was shaking, so they'd shake them in my face because they thought it was funny. Children, you know. And over time, those tremors have worsened. Today is actually a fairly strangely good day, which is very rare. Considering more often, part of that right now, you see my hands are probably not shaking too much. That's because I presently have my arms positioned on the arms of the chair in which I'm sitting to provide that extra stability. People with movement disorders and essential tremors typically, I mean, as we all know, those of us who have to deal with it anyway, are constantly accommodating our tremors and finding ways in which to move that make movement less of a pain in the ass. Often stabilizing the arms can help, but only to a certain extent. So as I mentioned, the tremors originally appeared in my hands, and at first it wasn't that big of a deal. I was still capable of playing the piano. I could feed myself with no problem, you know, all of that. Around the time of my sophomore year in high school, I realized that I was not capable of finishing essays, essay-based exams, largely because I had so much in my head that I wanted to write about, but not only could my hands no longer keep up with it, if I wanted my handwriting to be legible, I would have to take my time. And so it started affecting my grades a little. We quickly came up with the solution to start just typing my exams. I would go into the learning lab and be watched over to make sure I wasn't cheating and everything else. You know how it goes. And it soon came to having, at university, I would bring my laptop everywhere and take notes. I tried taking notes by hand, but for obvious reasons that didn't really work. But because I can, before my hands got to where they are now, I was still capable of typing as quickly as someone could speak, so it wasn't much of an issue. I credit much of that to I guess, my experience with piano and then typing classes, because yes, in the 80s we totally had them. Or at least we did in my school district. But I guess now at the age of 36, I don't cook food. I am too, at most, I will nuke some soup. Largely because I'm afraid of burning myself. I'm afraid of cutting myself. I'm afraid of flinging things everywhere. And the reason I fear this is because that's a normal, everyday thing that I experience. I can't really play the piano the way that I used to. I can still read music without, much of an issue, but it's affected my vibrato. I'm sure there's probably some slight movement to this video. My legs are shaking a little. So I've got them stationed against my desk to provide more stability for the laptop that is in my lap. But I apologize. I'm looking at two different screens. I wanted to try and keep a timeline of events. Like most other people with essential tremors, I have been on the medication roller coaster. It started off with propranolol, which seemed to work, but I had severe exhaustion issues, and this was before I was diagnosed with depression, though depression was also definitely a contributing factor. And because I was very active at the time in track and field, going into my freshman year of high school, they put me on a different medication called myceline, also known as primidone. Being on that medication for the entirety of the rest of, for basically the entirety of high school was hell. In addition to being a hormonal teenager who was struggling with other complex neurological and behavioral issues in addition to mental health, myceline was not a good medication for me to be on. It wasn't until I started at University of North Texas that a psychiatrist who had experience with, neurochemistry and neurological issues noted that I fell into one of the 2% category, I guess, a very small percentage of people who had an adverse reaction to myceline, uncontrollable mood swings. So that sort of describes my high school experience in a nutshell. Now I'm 36 years old, and I am in a wonderful relationship with someone who inspires me to be a better person. And because of this, I've been able to take the steps forward, the steps necessary to take back my life. I'm already on Medicaid for and SSI for major depressive disorder and anxiety, among, at least that's what I was initially diagnosed with, what have you. So Medicaid is what is providing coverage for the surgery. How much of it will be covered, I will find out. Thus far, the only thing that Medicaid hasn't covered was, I think, the neuropsychiatric evaluation. But that's about it. So to go over the timeline of events, well, first let me go back to all the medications I've still tried. There was, after myceline, there was Topamax. There was also an attempt back at propranolol again before that, while I was living up in Canada. And then, of course, there was the gabapentin Gabapentin certainly worked, but it affected my ability to process pain. And again, major fatigue issues, which when you're already battling major depression, in order to maintain a level of function, you can't pile up like any medication that has the side effects of fatigue. It sucks. And as I've been on clonazepam for panic attacks, which is, funny enough, another medication that they occasionally use to treat essential tremors, it was sort of the let's try everything train, and everything has been tried. So now, that brings me to October 28th. My primary care provider referred me back to Dr. Hugh, Hugh or Who. I really don't want to mispronounce his name. He's a great guy. And he is with the neurology department at University of Washington Medical Center. And after speaking with him, and he had the opportunity to see how my tremors had progressed since he last saw me 4 years ago, he recommended and referred me to Dr. Ko, a colleague of his who's in the neurosurgical department of University of Washington Medical Center. I went and saw Dr. Ko about a month later not quite a month later, but close, 3 weeks later, on the 18th of November. We then discussed, the different surgical procedures that were available. Of course, as I was concerned about the invasiveness of it, my first thoughts were to look at the gamma knife procedure or the ultrasound. Typically speaking, those are procedures that are usually reserved for people with health issues that would make the deep brain stimulation surgery not acceptable for them. Typically, those two procedures are for people who are older in age or have, other health issues that would make slightly more invasive surgery very complicated. So there's also another part of that. The ultrasound and the gamma knife radiation function by making a lesion on your brain. That, pardon my language, that shit is permanent, and they can't control any of the side effects that may come with it. And there is also a chance that the tremors could resurface after a time. So they're still very new procedures and typically reserved for people who are significantly older. So he suggested the deep brain stimulation, and we discussed it, and he laid it all out for me. And I'm someone who prefers to have all of the information. The more information I have about the process, the more I can make an informed decision. Knowing every aspect of the surgery actually makes me feel a lot more comfortable, mainly because with facts I can at least try to logic my anxiety into submission. It doesn't always work, but so that was November 18th, and a month after that, close to December 12th, I had an appointment with the rehab medicine clinic at UW, and this was something that Dr. Ko referred me to, and one of the 2 or 3 things I had to do in order to have the surgery. The appointment with rehabilitation medicine was to determine how, if at all, my tremors have affected my range of motion, and to establish a baseline to compare my range of motion before the surgery, and then after the surgery, and then following the subsequent activation or programming sessions. This is important because it helps the team gauge whether or not the current is too strong, whether or not they need to dial down a little, whether or not if you are experiencing any side effects, is it because of the surgery, or is this something that was just present beforehand? Just establishing a baseline for comparison purposes. And it was really interesting because it's not something I had ever been through. I mean, yes, I've been through physical therapy for things like injured back or for a broken leg, but this is a little different because it made me think about how essential tremors has affected my motion in general. And it was really interesting because it has affected my motion in general. You know how they tell you always to lift with your legs and not your back? That doesn't work for me, because trying to lift with my legs makes me lose my balance and I tend to fall over because I'm shaking. Quick pivotal turns I will lose my balance on sometimes, or more than sometimes. They were just, I never knew how much I'd been compensating. And so it was a very, very fascinating process that I actually really kind of enjoyed. So that was in December. In January, I decided I wanted to start the process of mental preparation for the surgery. So I lopped off my hair. My hair was past my shoulders. So for a while, I was sporting a pixie cut with a shaved head and then, like the top leftover bangs hanging. It was really cute. And I've decided I kind of want to keep it that short, mostly because I like wearing wigs, which is weird, but I discovered I like wearing wigs. So I did that, mainly because I decided that doing that 2 days or the day before surgery would be too much of an emotional experience. And I think I made the right call there. So that brings us to the 2nd of February. The 2nd of February was when I met with people on the neuropsych team. I met with Jane Stevenson and Dr. Goldberg for a neuropsychiatric evaluation. And this evaluation really helps determine how your brain processes information and helps you document your strengths and weaknesses in terms of information processing. And, hi, baby girl. And, honestly, it's a really, really fascinating process. I learned a lot about myself. Nothing that was terribly surprising per se, but something that I simply learned things that validated my experience as a human being, which I think is very important. Honestly, even if you're not going in for surgery or anything major, I think a neuropsychiatric evaluation is great. I think everyone should have one, because to understand how your brain works and processes information helps you learn how to better prepare and make accommodations when you are dealing with things at which you have difficulties grasping. But it was really, really cool. And there's also a small component of the evaluation that analyzes your moods and emotional state. And again, this is all done to provide a snapshot of a baseline. Because I am mentally ill, and because I do wrestle with major depression and anxiety, it's also important to be able to document my moods. While brain surgery does not typically, they don't typically see, I guess, a lot of emotional mood swings following this type of a procedure. Sometimes there can be. Brain surgery can affect that sort of thing because, brain surgery. But having a snapshot helps compare a baseline so they can adjust things if they need to, address issues with the medication that I'm currently taking if they need to. And they're just more necessary precautions. And then 2 weeks after that, on February 15th, I had my appointment with the pre-op nurse practitioner under Dr. Coe. Her name is Courtney Weaver. She is, affiliated with the neurosurgical department at UW Medicine. And then I also met a wonderful woman whose name escapes me. I feel very sorry because she was really cool. She was a wonderful neuro nurse affiliated with the anesthesia team who gave, between Courtney Weaver and this neuro nurse, they gave me step-by-step descriptions of how to prepare and what to expect. Today is February the 28th, and we shaved the last of my hair off today. We're in prep for surgery, and they'll probably shave some more, once they've got me immobile and still. Which leads me to the 2nd of March. That's in 2 days. I'm going in for the deep brain stimulation electrode and lead placement for the left side of my brain, which will affect my dominant writing hand. Because of my issues with balance and because the stimulation from the generator and electrodes can affect that, they didn't want to do both halves. Dr. Coe didn't feel comfortable doing both halves at the same time, which is frustrating on some levels. I'm not frustrated with him. Oh goodness, no. It's the right call to make. But as I am on Medicaid and I do not know whether it will continue to exist under the current administration, fuck Donald Trump, I'm basically just doing one half first. And there you go. The 9th a week after the initial procedure of the leads and everything, I will go in for the placement of the generator. So, what is all of this? What are they going to do? Well, essentially, the night before the first surgery, basically tomorrow night, I get to use half of this bottle. Chlorhexide gluconate, something, 4% solution. It's an antiseptic. Dynahex 4. It's an antiseptic. So this is what they want me to bathe with from like here or here down. Half of the bottle the night before, and then the other half the bottle in the morning. They gave me 2 bottles because I have to repeat this on the night of the 8th and the morning of the 9th. Woo! So the surgery on the 2nd is scheduled. I need to be checked in by 9:30 in the morning. The surgery, I do believe, is scheduled for 11:30. There will probably be there may be delays. Who knows? It depends on how crazy things are in the surgical pavilion. But essentially, they're going to take me back and get an IV going and do all the wonderful things that they do. But they're going to make an incision, and they're going to use a combination of the basically a CT scanner and a map of my brain that they already, or a model of my brain that they've already sort of played with after an MRI, which I had back on the 15th of February, to sort of navigate my brain without being too invasive. They drill a hole in your skull. Woo! But it's on one hand, it sounds really, really scary because they're drilling a hole in your skull. But the reality of the situation is that the procedure is not as invasive as one would think. I mean, yes, it's brain surgery. Yes, it's serious. Yes, all of this. But it's, let's just say this is not 1987 and I'm not the first essential tremors patient to have this procedure. It is now 2017, so they've had decades to perfect it. Honestly, I'm really comfortable with the notion of the procedure. I just don't like not having control over situations because anxiety. So my most anxious thoughts tend to be around going to sleep and not waking up, which is very not likely to happen. But discussing my fears and putting them out there is something that I want to do because I'm sure it's something that every person who has had this procedure or is considering this procedure has wrestled with. So, drill a hole in my skull, use some creative navigation to put place the electrodes and the lead, and they'll leave it curled up here. But halfway, once they've got the leads placed, they'll wake me up and see if they need to move them around. They'll hook it up to a generator that they'll have with them to see if the electrodes and the lead are properly placed. And once they've done that, they'll put me back to sleep, and they'll put something there. No, they're not just going to leave a hole in my skull, for crying out loud. This is not the Dark Ages. And send me on my way. I mean, the surgery is like 4 hours, maybe 5. So in many cases, it's fairly short. I mean, you think about it. Brain surgery. 4 hours. Science is a wonderful thing. This is why we should always trust science and facts. Because science is usually based on peer review and facts. Things which people in political power seem to forget. And in any case, I'll try to keep my political views out of this. No, I won't. Being that Medicaid is the only way that I am able to undergo this procedure, and because I am disabled, I don't know if there will be something in place for me in the future to get the other half done. The other side of my brain, the other hand, which is unfortunate because I want to be able to return to the workforce. Even if I, together with my therapist and other doctors, have realized that I probably will never be able to handle more than a part-time job just because I don't handle stress very well. I still want to be able to do at least that much. I still want to be able to do volunteering. I want to be of use to the community. I want to give to the community that is given to me. And I'm not going to be able to do that with just one half done. Sure, I'll be able to handwrite and hold a cup of tea, but I don't think I can accurately put into words what it is like to struggle to do the most simple, basic tasks with your body. And how important it is to have both halves done. Now that I've rambled about that. So, presumably, everything will be fine, and they'll leave the lead coiled up here for about a week. They'll keep me overnight in ICU, just because it's a cranial procedure, an intracranial procedure. That's normal. They want to be able to make sure that keep track of me. Their biggest concern with this type of a procedure boils down into two categories: infection and swelling. Yes, there are potential. There is the potential for a brain bleed. Yes, there's a very minute risk, and I do mean minute, for stroke. But the benefit of having this procedure and having control over my own body again outweighs any of the risks as far as I'm concerned. So, as I mentioned, I'll leave this curled up here, and on the 9th, I will go back in for an outpatient procedure. They will use a device to take the lead that has been coiled up here, and they will push it down my neck. I'm not quite sure how they do this yet, but apparently this is a procedure that hurts more out of the two major phases of surgery involved, because your brain doesn't have pain receptors. You may still feel pain from, your scalp or from the wrap that they put around your head to keep pressure from building, to keep the swelling down. But usually there isn't copious amounts of pain. It's more the second procedure, because what they do, or however they move the lead down your neck, tends to leave people a little sore in the neck. And then they'll probably choose a place right around here, which is above my left breast, to put the generator into a pocket of fat. And then they will connect the lead to that generator, and, once everything is secured in place, sew it back up. And then about a month, I don't know if it's a month from the 2nd or a month from the 9th. I'm hoping it's a month from the 2nd. We'll have the activation. This is not an immediate, wow, you've got a generator, so you're good to go, right? No. After they implant the generator in you, they don't usually leave it, how do I say this, on. It takes about a month for your brain to process changes, to process, everything that they say. It takes a month to develop a habit. I don't know that it's quite the same with devices that are put into your brain. I'm not a scientist. I don't have the experience in this field, but it would stand to reason that giving your brain a month to recover from these sorts of changes before going on with the initial activation would be a logical step. So, a month after the surgery, they will turn it on, and we will go into the first programming session. Now, it can take anywhere between 2 to 6 sessions to find the right frequency, if you will, to control your tremors. It is not a wham bam thank you ma'am process, though some people only need it, that first session. It varies. Your mileage may vary. Each person is different. Each person will respond to the treatment and things of that nature differently. So that's, I think I've covered everything. I'm trying to fit a lot into a very short amount of time, mainly because I wanted to document this and share my experiences with other people with essential tremors or Parkinson's or any other movement disorders which is helped by the deep brain stimulation surgery. I will continue to keep y'all updated as I remember to, and I hope this has been of help to y'all. Bye.